Today we are going to talk about PCOS, which is Polycystic Ovary Syndrome. And this is a major cause of infertility in women. In this condition, you're going to find that there is overproduction of androgens, and by androgens I mean testosterone. The hormone imbalances is the major mainstay when it comes to PCOS because it messes up the whole cycle by disrupting the hormones. So you're going to find follicles in the ovaries and cysts also. But these cysts might contain liquids or not, but the major mainstay here is they usually contain mature eggs which were not ovulated. So you get to see the features of the ovary using an ultrasound, and this is where you now get to see the individual cysts and all those that are affecting that cycle and production of that hormone. In ladies, you're supposed to have more estrogen than the androgens. Estrogen is supposed to be higher than testosterone. In ladies, on a normal circumstance, if you have more of estrogen, it's going to suppress the testosterone. But if you have more of testosterone, it's going to suppress the estrogen. And that's why you have those hormonal imbalances. And also the same case usually happens to men, but now this is in reverse. Men will have more of testosterone and less of estrogen. And if there is maybe you have a higher concentration of that estrogen in you, like as a man, you're going to find some other features that are so common in ladies. We have several signs that might be pointing to you having PCOS, and one of them, which is a major one, is having irregular menses. However, you might find that maybe this time you got your menses, but then you stay for like another 3 months, 1 month, 4 months without getting them. And when you get them, they are so heavy and they are followed by so many other complications like cramps, very painful menses, and so many other conditions that come along with that. This might also lead to you not getting the ovulation, meaning that even your fertility is going to be hampered. This condition is going to affect your fertility because if you cannot ovulate, there's no way you're going to get pregnant. Like we mentioned earlier, when you have more of androgens, they promote abnormal growth of hair in the body. So as a lady, in case you find that you have more hair, especially on the chest, in your hands, your legs, you have more hair than required, chances are you might be having more androgens, the testosterone. And this is one of the symptoms of having PCOS. Now, if you combine this with other symptoms that we are still going to look at, then this might be a really good indication of you having those PCOSs. There is a video I did on acne. I don't know whether I did it here or on TikTok, but one of the reasons or the triggers that we mentioned was hormonal imbalances, which is brought by having more of androgens, especially when it comes to ladies. Now, the androgens, which in this case we are talking about testosterone, leads to the increase in size of the oil glands under your skin. And this may lead to overproduction of sebum, which is now the oils that comes onto your skin to make it supple. And when that happens, when you have overproduction of that, you're going to increase the chances of clogging those pores. And when that happens, then you're going to have those bumps, and they might attract bacterial infection. And this is where you're going to have acne. So meaning acne is one of the symptoms of the PCOS. Now, obesity or overweight is one of the other factors. Now, this is slightly interesting because, one, if you are overweight, you might trigger those signs of PCOS. And at the same time, you might find it hard when you already have those, the PCOS, when you already have them, and you have hormonal imbalances, you're going to find it very hard to control the weight. Again, this now will work in reverse. Now, when you have the PCOS, it's going to trigger you into gaining weight. And when now you gain weight, it's now going to even make this condition even more severe. So having abnormal or uncontrolled weight might be one of the symptoms of PCOS, because when you have obesity, you're going to have so many of those hormones being disrupted, and when you disrupt your hormones, your cycle follows the same suit, they become disrupted, and this is one of the mainstays, one of the triggers of PCOS. Another very classic sign is having acanthosis nigricans. Now, this is darkening of the skin where it folds. Like, for example, under your armpits, around your neck, on your groin area, especially between the legs and under your breasts. So you're going to find unusually dark patches, and this is due to insulin resistance. It causes this. Now, when you have insulin resistance, it means that you have uncontrolled sugar or you're already diabetic. Now, this might also be brought by you being overweight, like we mentioned earlier. So if you have that, if you're overweight, it means that maybe your body is not able to handle well sugar. So when you have that, or being overweight is one of the contributing factor to getting insulin resistance, because you have elevated blood sugar in your blood for the same prolonged period of time, and when this happens, your insulin start becoming less effective at doing what it's supposed to. So it leads to now the darkening of some patches, especially where the skin folds, and we call this acanthosis nigricans. So this is another classic sign that you might be having PCOS. Now, the symptoms that you're talking here might either happen in isolation or in combination. So for example, you might be having irregular periods, you have acne, you are obese, maybe you are even having the patches of dark skins, like what we've called acanthosis nigricans, and something like the cysts. Now, the cysts in your ovary, they're not obvious, so you can only get them when you get an ultrasound. Now, this is not obvious because you cannot see them, you cannot feel this. In actual sense, you might actually get to know that you have PCOS when you visit a fertility clinic after trying to get pregnant and you're not getting. So when you visit them, you go get some of those screenings, and one of them, which is being the ultrasound to your ovary, it now shows that you have cysts in your ovary, or your ovaries are enlarged, and this is because of maybe stacking of those unovulated ova. So if they just stay there, your ovary might also increase in size, and it's also going to contain those cysts because you already have ovaries which are inside there. They were not ovulated, so they're going to form like a liquid part surrounding those ovaries. Yeah, and that's what we are calling the cyst. Skin tags is also another classical symptom of you having insulin resistance, which is also a classic sign of PCOS. We talked about growing hair because of the androgens. Now, thinning of the hair, the scalp hair, this is usually because of the hormone that you talked about, the androgens. This is testosterone. When you have that testosterone, and that's why mostly men go bald, because of this hormone. It's common in men. So you're going to find that you are losing your scalp hair, and this is due to now the increase in the androgens in you. And of course, to sum everything up, infertility. So infertility is one of the symptoms of PCOS, and this is because of disruption of everything that you've talked there. So the system has to be very ready and not disrupted for you to be for you to get pregnant. So when nothing is working, then you're not able to gain fertility. But you should not worry, because sometimes you can also be assisted to reproduce through something like IVF. Now let's go to treatment. In treatment, I'm going to divide this into two. One is when you don't want to get pregnant, you only want to control this condition, PCOS. And the second one is when you want to get pregnant, and you want also to control PCOS. Now let's start with the first one. The first thing is hormonal therapy. Now you start taking those pills, the pregnancy pill, the contraceptives, the hormonal ones. They are going to help in controlling the hormones in your body. So they help in stabilizing your hormones by supplying what is not there. If the issue that you have is, like we said, overproduction of testosterone, which suppresses estrogen, we can increase the estrogen in you, and this will have antagonistic effect on the testosterone, and this will eventually improve this PCOS condition. The second one is using insulin sensitizing drugs like metformin. This is usually used in when it comes to control or treatment of diabetes. If you suspect, or maybe if you have insulin resistance, this drug or these drugs, it's a group of them, they're going to help you in controlling that condition, and when that is resolved, you're also going to resolve PCOS. We have drugs that help in blocking the effects of androgens, and most of them are estrogen based. So if you want to control the androgens, like we said earlier, you'll have to control that by using the antagonistic effect. So if you want to control that androgen, you're going to increase estrogen. And you have drugs that help in that. So yeah, so talk to your provider and they will be able to give you exactly what fits your condition. Now this is very important. You need to adjust your lifestyle in case you are overweight or maybe you're obese, because if you have abnormal BMI, then like we saw earlier, you're going to have so many effects in your body, and this will not improve PCOS condition in you. So you'll have to first of all make sure that your body is fit and within the normal range of your BMI index. Now let's go to when you want to get pregnant. Like we mentioned earlier on, if you are not ovulating, you're not going to get pregnant. So one of the therapy here is to use the drugs that will help in you ovulating, because when you ovulate, you are first of all going to become fertile. When that happens, several things will cascade down. One, the release of that ova leaves what you call corpus luteum, and this corpus luteum will help in production of other hormones that will lead to sustaining of that pregnancy or sustaining of the uterine cavity, the walls of the uterine cavity, and this helps in sustaining of the pregnancy. So if you want to get pregnant, you have to make sure that you're ovulating, and we have several drugs. Like I know we have gonadotropins and some others. I'm going to list there are three. We are going to list three of them here. We have others, which are so many, but I have not interacted with them. I have interacted with these three. Now, another intervention that will lead to you getting pregnant is surgical procedure. Now, this, they are going to do surgery and they are going to target the ovary. They are going to remove the tissue in that ovary that's leading to the production of those androgens. When that is removed, the effects of you having high testosterone in your body will they are going to decline, and when that happens, you have the reverse of all the effects of having high testosterone in your system, and PCOS will resolve. In case any of what I've mentioned above does not work, then you can have assisted reproduction, whereby you're going to find something like IVF. This is in vitro fertilization. Now they get your ovaries, now they get the sperms from your spouse, and then they are fertilized. And in case you want to have a surrogate mother, then that combination is implanted in someone else. Or if your uterine cavity can be able to handle carrying that baby, then it's implanted into your uterus, and then that baby grows normally. You're going to have that baby later on after 9 months. I hope that was an informative session. You gained something at least. So in case you did, give us a like, give us a sub, and also share this to those people who are interested. And let's continue the conversation down in the comment region.